You back to the health minister's briefing. Dr. Aaron Motsoaledi is admitting there are problems in the public healthcare system, but he is convinced there's no collapse. The minister was addressing a media briefing in Pretoria this afternoon. The briefing was prompted by the Health Ombudsman, who says the public health system is on the verge of collapse.
It is very true that and self-evident, really, that the healthcare system is very distressed and going through very hard times. There's no question about that. The burden of disease and hence the demand of healthcare has grown so exponentially that the system finds itself extremely overloaded.
Well, Motsoaledi says the health system is overloaded. He says people must not forget the strides government is making in the fight against HIV and AIDS.
This healthcare system is still able to provide treatment to the largest number of HIV-positive people globally. As I have already said, our HIV/AIDS program is the biggest in the world at 4.2 million people. In the next 24 months, we are poised to initiate an additional 2 million people. So in 24 months' time, there will be 6 million South Africans who are on ARVs. And we are ready to launch that on the 28th of June, that is this year.
Aldrin. All right, eNCA reporter Aldrin Sampear is in Pretoria for the health minister's media briefing. Let's go straight there for a debrief of that interesting briefing. So talk to me, Aldrin. The minister admits that there are challenges and the system is in crisis, but it appears there's an explanation for the individual components of this crisis, but definitely not a matter of collapse.
Well, certainly that's what this briefing was. I pointed out to the minister in that one-on-one that I had with him earlier on, which will be played in the next hour, where I pointed out to him that if you look at the statement that he has issued, the 6-page statement, he doesn't speak about a crisis. He speaks about burdens. He speaks about how there's strain on the system and so forth. And he says that it was a matter of a choice of words. However, though, remember that one of the reasons also that he had this press briefing was actually to rebuttal the interview that Professor Makgoba had with Tim Modise, where he spoke about the system being on the verge of a collapse and speaking about a crisis. Now the minister does admit that indeed there is a crisis, but there are various issues, as you've indicated, that have led to this crisis that the country's health system is currently faced. He spoke about the human resources issue, where you have the country, or the sub-Saharan Africa, he says, facing 80% of the world's diseases, burden of diseases. However, only 3% of the human health resources that are based here in sub-Saharan Africa, and so of course South Africa is also affected by that. He does indicate, though, that some of these are self-inflicted, the case in point being the Northwest, he says, and also here in Gauteng. And that's the reason why he made the argument that one of the questions that was asked to him is whether he's considering placing the Gauteng Health Department under administration, also considering Professor Makgoba's assertion that of the 2,000 complaints that he's received so far, 800 are coming from Gauteng, and the minister's own admission indicating that Gauteng has failed to fill some very critical positions. And he said that if those positions are not filled, indeed, the department will have to be placed under administration.
So that talks there, Aldrin, to issues to do with the filling of posts and also in as far as generally, broadly, the whole state of the healthcare system from the minister's perspective. What then did he say about the issue of drug stockouts, which has been raised by the South African Medical Association, as well as the state of some of the infrastructure that we see?
Actually, he went through a list here where he pointed out, and I'll quote him, he says, let me just get this quote. He says, "Our weekly monitoring for the last week ends today, and our information shows, quote unquote, nothing but stockouts. He went through a list of various provinces, including the Eastern Cape and Gauteng, and saying that Limpopo is the worst affected, which is only at 87.8% of 87.8% stocks that province had. So this doesn't point to a system that does not have the medication or critical medication that is needed in these various provinces. So he has definitely shrugged that one off, or rubbed that one off. On the other hand, he also spoke about the burden that the health system is being faced with at the moment by immigration. People coming from the SADC regions, our foreign nationals coming from SADC regions, and using the hospitals in the country, and he says that this has placed a burden on the country's health system, and that's the reason that he wants to meet with the DG of Home Affairs to look in some of the migration laws that the country has and how they can make sure that this law does not burden the health system even further, because he says that if, quote, you do not help foreign nationals, you are accused of being xenophobic, and when you do help them, you are accused of putting taxpayers in the country under strain and burden.
All right, Aldrin, just a final one then. I was speaking to Zikhona Chona a few minutes ago, and we were remarking that we didn't hear the minister talk about the state of mental health care in the country, given what we saw with Life Acid Dimeni, which, you know, one imagines would be the biggest lesson for everyone involved in health care, and also what we're hearing now about Tower Hospital in Fort Beaufort. So we give the caveat that, you know, there's a chance maybe he did speak about it after we were no longer live to the minister. Did he?
Well, I had an opportunity to have that Q&A with him, a one-on-one, where we spoke about this issue. And as I've indicated, that Q&A will play in the next hour or so, where we spoke about the issue around Fort Beaufort, where we find this hospital, which is called the psychiatric hospital, the Tower Psychiatric Hospital. And you know, of course, that Professor Makgoba is headed to the Eastern Cape to deal with some of the complaints that have emerged from that hospital and from that province. He also indicated, quite interestingly, that after they've received the complaints rather, as the department, they initiated their own investigation. But he says that looking into that investigation and its findings, that the findings are so dire that he believes that it must not be the department that releases this report, but it must rather be the Professor Makgoba, who goes and does his own investigation, and he has handed over this report to Professor Makgoba and said that he must look into the situation at the Tower Psychiatric Hospital. He also spoke about, if you look into the mental health laws as it stands at the moment, and he says that also look into Makgoba's findings in the Life Acid Dimeni matter, where he said that there must be some amendments to the Mental Health Act as it stands, because the minister is not consulted. And he also gave some clarity with regards to this, that he was saying that what I was asking for is not to be consulted when it comes to the appointment of MECs. However, though, the MECs of health who have been appointed, they must consult me as the minister when it comes to decisions of such grave nature, which could impact on the lives of patients, which could impact on the life of the country, and saying that the Life Acid Dimeni crisis has led to the country's image also taking a knock internationally.